In the anatomy of temporal bone, we have the tympanic bone here, and posterior to it is the mastoid bone, and above is the squamous temporal bone, and the sleeve-like structure is called the petrous part of temporal bone. And medial to the petrous bone is the brainstem having midbrain pons and medulla. And this is in the petrous part of temporal bone, we are having this internal auditory canal, and also the petrous part of temporal bone holding the inner ear, vestibule, semicircular canal, and this cochlea. And which are the nerves passing from the pons are 5, 6, 7, and 8. And fifth nerve and sixth nerve are going to the apex of the petrous bone, and this seventh nerve and eighth nerve traveling in this internal auditory canal, and eighth nerve is supplying the cochlea, vestibule, and semicircular canal and stop there. And this seventh nerve, our facial nerve, continues to supply the middle ear, continues to supply the inner ear, the middle ear, and the mastoid, and exits in the stylomastoid foramen. And whenever we have the middle ear infection, the disease will spread from the middle ear to the mastoid. The most commonly, the infection will spread from middle ear to the mastoid, and we call it as mastoiditis. And if it spreads to the inner ear, we call it as labyrinthitis. And if it goes to the petrous part of the temporal bone, we call it as petrositis. And if it spreads to the squamous part of temporal bone, we call it as osteomyelitis. And we see this seventh nerve is traveling all along the inner ear, middle ear, and mastoid, so we call it as seventh nerve palsy.